Hey Josh, how's it going?
I'm doing great, Elliot. How are you?
I'm doing pretty well. I'm excited about our conversation today. To kick it off, I think I'll set the stage and say healthcare costs, the big scary in early retirement, right?
Yeah, most people just probably should keep working, right?
Yeah, I think that's the clear solution is that the only way to get health insurance is by having a job, so you better just work until you die.
Or have a spouse that has a job.
That's right. Good old Wi-Fi works for you at this current moment.
Yeah, I tell her all the time she has to keep working until we're both 65.
That's right. I know that you gave me some homework and I actually did it for a change. So we listened to the Bigger Pockets Money episode. Are you alive?
Really bad timing there. I apologize. I have to
No,
throw this in at the end as a blooper.
that's right. Not a
Drink went down the
problem.
wrong way. I'm going to
Yeah.
leave myself on pause while you keep talking so that I can keep clearing my throat.
All right. So yeah, you gave me some homework of listening to the Bigger Pockets Money episode with Scott and Mindy, where they were talking about healthcare costs in early retirement. And it was pretty cool to see some of the tools and things that they publish out there for free. The disclaimer is it's all for entertainment purposes, clearly. Consult your professionals. But yeah, they're pretty slick in seeing some of the different costs and how much variability there really is between different states and other factors. So, did you take a look at some of that?
I did, yeah. I watched that episode on YouTube and I listened to the audio first. And then I went out and poked around on some of those calculators just to see if they were going to be similar to what I was getting from HealthCare.gov. And I did notice a discrepancy for my specific variables against theirs. But I think there's a caveat in there that it's like you said, it's just for informational purposes and they're trying to just estimate it based on the information that they've put into their model.
And still, even let's say it's not 100% correct, I think it does give you a good ballpark for understanding really what are the different factors that are up for consideration. Obviously, the number of people in your household, the age of different members of your household, how the subsidies play into premiums, all those different things. I thought it was a great informational tool, at least to set the landscape of what are all the different factors that you really have to start to consider.
Yeah, don't forget zip code. So if you listed out the top contributors or variables that you have to input in there, it's zip code, which makes a tremendous difference. And he went through and gave like an example of New Hampshire versus Vermont, I believe it was, and how incredibly different those two states are. And I went through that exercise as well. I just pulled a couple random zip codes from healthcare.gov. I used them in healthcare.gov just to see what kind of variables I would come back with. But yeah, I'll just kind of real quick, I'll go through the instructions because I think this is kind of an exercise that hopefully the more of us that are talking about it, the more information that we share out there, the more familiar we get with the tools that we have access to right now. And of course, the caveat is this could all change, the rules can change, the policies can change. All of it is just as of right now, 2026. But you go into healthcare.gov and you can click on browse plans and costs. And then it's really simple. You just enter your zip code, some of your household information, like your age, and some of the health related topics that they ask for, like whether or not you have eligibility for getting health care through your employer, or if you're pregnant, or if you're a tobacco user. And then your expected income, which is where that subsidy cliff comes into play. And I'm using $84,000 as the amount for me, which is my family size would be two, me and my wife. yours would be substantially higher than that because you would have 5 family members, but you calculate that based on 400% of the federal poverty level, that would show you what kind of subsidy you would be eligible for. For me, and this is an area that I think it's interesting that there's a lot of chatter, even in their podcast, they were saying healthcare costs have increased. And I don't know if that's across the board. I'm not exactly sure what they were referring to there. But I know I actually went back and looked at our case study presentation that we gave to our local Choose If I group a couple of years ago. And I had put in there $500 a month for the two of us. And as I went through it today, and I've gone through it several times, I've seen that I'm just looking at like the cheapest bronze plan, and I'm eligible for subsidies of a little over $700, and then the bronze plan would be $381 for us right now. So significant savings if we can keep our MAGI below that threshold and get those full subsidies. So it's really valuable tool and worth poking around at.
Yeah, exactly. I think that was really one of the biggest takeaways. And I know that we've talked to our buddy Alan in our local St. Louis area and talked about really the subsidy cliff is one of the biggest considerations in all of this, right? It's one thing to say that, yeah, healthcare was expensive, but to your point, it's a substantial amount of premiums that you get reduced through those subsidies if you're able to keep your modified adjusted gross income within those specific levels. And I know that there are other ways that you can tweak that. You can be putting money into an HSA and other ways to exceed that $84,000 kind of sweet mark or whatever. But yeah, no, I thought it was pretty cool to see the tool in action. It was also very interesting, I would say, to your point about inflation on just costs, that, yeah, I think that they quoted something like 26%. That seems insane year over year of a growth. But I think it was important that what Scott was bringing up was, yeah, hey, it is important that these are one of these expenses that you would expect to increase in costs year over year, and you should model it to at least at inflation.
Yeah, and they liked to give the caution that you should look at the full price, the full sticker price, should you be in a situation where your modified adjusted gross income goes over that threshold and you're not eligible for those subsidies. And I think that's good practice. I think that depending on the family size and certainly your expenses and where you are, it's something you're going to have to be aware of. And if you're somewhere near the edge of that cliff, it can be pretty a significant increase that you would need to make sure that you're just going into it eyes wide open, that should that come to fruition, you might need to come up with an extra $20,000 for that year for paying for those premiums.
Yeah, absolutely.
So I'm curious, did you go through the exercise?
Going through on healthcare.gov.
Yeah.
So I didn't look specifically on healthcare.gov most recently. I know that I have in the past, but I did not specifically in preparation for this episode today. No, I went through more the sheet that was just out on BiggerPockets Money, but I know there are a lot of different factors that can be tweaked for my specific site.
Do you know what the modified adjusted gross income level would need to be for your family size? I think that's searchable. What is it, just 400% of the federal poverty level of a family of 5?
Yeah, let me go do homework.
Well, I thought maybe we could just do this real time and you could pull up yours and it only takes like a couple of minutes. Looks like it would be $154,720, which is
so a few
pretty
more
high.
dollars. Yeah.
Yeah. I don't know. Based on some of the conversations we've had, it seems like you should be able to fall within that and live a pretty comfortable life.
Absolutely. I don't intend for our family to spend anywhere near that amount. So, yes. But yes. 154,720 is what I see according to HealthCare.gov.
Yep. So if you used that and plugged it in, I mean, I don't know. Do you want to go through the steps real quick? It literally will probably take you like 3 minutes.
Sure.
I'm holding you
So
accountable over here, Elliot.
that's right. No, that's good. If I, do you want me to share my screen while I do this?
Oh, sure. Yeah. I didn't even think about that.
Let's see. All right.
Can you go all the way back to healthcare.gov? Just
Yeah.
the homepage? Yeah. And then click on browse plans and cost. And then start there with your zip code. And so we select it as zip code. And then the next prompt is to tell us about your household. And you're going to ensure you and family members, dependents, 3 dependents. I don't think there's anything too personal in here.
I was gonna say, now we're getting personal.
Yeah. We now
See,
know that Elliot is 39.
I am. So we're assuming that we're retired, right?
Correct.
That's
Yep.
what we're doing here.
Yep.
You also don't see that Don is 36.
You list your kids. Go. And then this is where you would enter that number. And you can,
So let's
you
just say 100,000.
yeah, I was going to say you
Okay.
could put all the way up to that like 154 number. Just, it should still give you like the full subsidy.
154,720, right? That's what we
Uh,
said.
Back it down to like just 154 even, just in case. I don't know if it goes all the way up to that dollar amount or not. Estimated savings. Oh, it said you're not eligible. Okay, that's interesting. So close out of that. And now if you scroll down, you should see your plans and what the full price is. So now it's saying that you would have to pay $13.67 a month for your premium on the bronze plan, but it's because it did not give you the subsidy.
So
So go
let's
back
see.
to,
Yeah.
okay, so if you go click
Based
on
off the
view steps.
income. Yeah. I bet if I just go back one more
Yeah,
and let's just say
100,000.
100,000,
This
you
group won't be
may
covered.
be eligible. So now it thinks that I'd be eligible for Medicaid.
Huh, that's interesting.
Interesting.
Hmm. So yeah, it gets a little more. I have not come across these prompts or information. There you go. So you put in 120,000, which I guess is so you're not to the threshold where you would be Medicaid eligible. You're within the range of below the federal poverty level, but above the range for Medicaid, and you are
Right.
eligible for $1,011 per
Per
month
month.
in subsidy.
Right. And so in here,
Yeah, you can just, it should be sorted by
okay,
cheapest. So there you go.
505 a month would get my whole family insured, huh?
And that's going to be the cheapest. So it's going to
Sure.
have the
Yeah, the
worst
worst deductible, all the
out of pocket.
things. Let's see what the cheapest silver plan is. Okay, so that jumps a significant amount up to 949, so nearly double the cost for a silver plan versus just the bronze plan.
Yeah. But
So there you go.
a lot of considerations to make as the individual who's going to be going through those steps. And in your case, you have 3 young kids, so they're a bit more likely to end up in the ER or urgent care or whatever than maybe say, you and Dawn are. So does that change? Those are the things that you would have to weigh is, do I go with a bronze and then potentially go with all this out of pocket expense, kind of roll the dice a little bit? Do I go with the silver, have a lot more coverage? And, like in Lori and I's case, we're every time I look at it, I'm like, I think a bronze would be good enough for us. We're both healthy. We maybe to a fault, we don't go to the doctor for just some random ache or pain. We would try to self medicate first, and then if it doesn't go away after a certain period of time, then we would seek professional help. But I think a bronze would be good for us at this stage in our life. Now, 10 years from now, that might not be the case. And that's another factor in all of this is that with each passing year, as you age as an adult, those premiums are going to increase. That's the unfortunate one of the unfortunate things of how this all works. So if I were to go back into mine and change my age from 49 to 59, I think it adds a couple $100 per month.
And that is important to note that up until you hit that Medicare age is like those costs are going to continue to increase additionally as you have dependents that would potentially roll off your family. Those subsidies are going to change, all those different factors that you have to consider. But
Yep.
yeah. So have you shown Lori this to assuage any feelings of, hey, if you were to quit, this is what it would cost us?
She is well aware that we currently pay more for her employer health insurance than we would pay on the ACA.
Very nice.
Yes. And it's unfortunate. The health insurance that we get through her employer isn't great. It isn't as good as what we had through my employer, but it might be a bit better than the bronze. I haven't looked at him that closely yet, but even still, I don't know that it would matter a whole lot. I mean, some of those things, it's just you're going to pay $40 or $50 whenever you go see your PCP, or you're going to pay $75 maybe whenever you're going to go to the urgent care, something like that.
I tend to fall in the same camp as you is I would rather pay a higher out-of-pocket cost as opposed to the guaranteed cost of higher premiums. And maybe that is a bit rolling the dice, but I think that's the way that I would approach it as well.
Yeah. My 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 philosophy is if I take care of myself, I should hopefully in the long run have a lot cheaper healthcare costs overall.
Agreed.
All right, well that was cool, and I don't know what more we can talk about with this one, Elliot, but it was cool to have you walk through it and see now even I don't know how, from a like a budget standpoint when you were looking at using projection lab if you had factored in any specific number for that, but now you know kind of the range that you would be looking at.
Yeah, and that was exactly something that came up while we were doing some of those projections is I didn't know the number to put into those things. And yeah, it's cool to be able to have that at my fingertips now. I will say that I'll pull up the one from Bigger Pockets Money just so that we can show it off too. Since we cited it here in our conversation, I think it was a pretty cool thing that they had to share that allows you to really put in some bare bones information, do the same thing. So if I were to say, yep, hey, I'm 39 and Don is 36, three children, seven, five, in Missouri at 63126. So it does give a state range here. So that was interesting. And I think so. This is saying what it would cost without any sort of credits. I know if so, let's say I put in that 120,000 again and turn on, oop, put that in the wrong spot. If I put it down here, so we can see that this did add some subsidies, but based off of this, I'm it looks like I'm at 319% by that 120. So if I drop it down to 84,000, that's where that biggest credit was. So this says 223% of the federal poverty level at that, saying that, yeah, I have no cost for healthcare, is
Hmm.
that it's completely wiping out that premium. Now it does say that it's guessing you're paying about 5,000 out of pocket with this, but obviously from what we saw, it's not vastly different with that. So I think you would have to play around with what is that modified adjusted gross income versus your largest credit versus getting closer to that federal poverty level cliff, I think is where you could kind of sweet spot it.
Yeah, that's interesting that it's showing that Medicaid is less than or equal to 138%. And so that would be far less than 84,000. But for whatever reason, whenever you put in 100,000 on HealthCare.gov, it came up with that warning saying that for some reason somebody may have been Medicaid eligible.
Yeah. I don't know. I'll have to keep on playing with it.
Yeah,
All right. Is there anything else we want to say on that, Josh, or do we want to wrap it there?
I think we can wrap it there, Elliot. Hopefully, this is helpful for you. It's always helpful for me to go through these numbers and just have a peace of mind. And hopefully, it's helpful for anybody that might be listening as well.
Yep. All right. Thanks so much.
Yep. Talk to you in the next one.
Yep. See you, Josh.
See ya.